Hi everybody, welcome back to another episode of Unique People channel. For this interview, we're gonna be a little bit more serious because today we're gonna be interviewing Dr. Joseph Mashni. He's a surgical oncologist specialized in the area of urology. So today he's gonna be talking to us about cancer, the most common type, how he got into this career, and some advice. Before leaving, remember to subscribe and hit the like button. And look at this, I just learned how to do this. So I hope you enjoyed this interview and thank you.
My name is Joseph Mashni. I'm a urologic oncologist. Work for Banner MD Anderson, Banner being the biggest healthcare uh, provider in Arizona, MD Anderson being one of the top cancer centers in the world.
Can you tell us a little bit about your academic career into becoming what you are now?
Sure. So I went to medical school, then residency. During residency, urology has a wide breadth of specific areas, anywhere from pediatrics, female urology, kidney stones. There's specialties in doing laparoscopic robotic surgery. Ultimately, oncology is the big procedures, the one that take long, the ones that are the most complex. I wanted to be able to do those, be an expert in that, which led me to doing fellowship in urologic oncology. So after residency, I spent 2 years in New York training, a year doing research, and the subsequent year doing surgery with the world's experts in bladder, kidney, etc. surgery of that. My job as a urologic oncologist is part of a team, multidisciplinary, which is optimal for cancer treatment. The other main parts are medical oncology, radiation oncology. Then there's all the ancillary parts that are just as important, which include integrative oncology, which psychological, nutrition, activity, that includes alternative medications. But as a big team that includes genetics, specialized people reading the pathology, radiologists that are also diagnostic as well as interventional. So it's a big team in collaboration for kind of optimal cancer treatment. Cancer as itself is a scary word. That's why we spend our time to try to be able to form the best plan, spend the time to be able to relay that to the patient and their support structure. As the surgical component of the multidisciplinary team, I'm the one that performs surgery or procedures, open surgery, laparoscopic surgery, often assisted with a robot. We also do endoscopic procedures, which are using small cameras to be able to go in and do it minimally invasive that way.
From those, what will be the most common procedures that you do?
So as a urologic oncologist, I just treat the genitourinary system, which includes most commonly prostate cancer, bladder cancer, kidney cancer. Then the rare tumors like adrenal tumors, penile cancer, testicular cancer, urethral cancer. Most common procedure, prostate cancer being kind of the number one cancer that affects men, is robotic prostatectomy. Removing the prostate, reconnecting the bladder to the urethra, preserving continence and erectile function. With prostate cancer in particular, in the United States, about 300,000 cases are diagnosed per year. About a tenth of those actually lead to the death or the cause of death for that man. So screening is very important. We're trying to find those men that we can actually prevent death from prostate cancer. It's done by the primary care doctor, usually a blood test and a digital rectal exam. If those are abnormal, then they're referred to a urologist like myself, where we do further studies.
Joseph, what would you recommend people from the point of view of urologic oncologists?
From just an oncology standpoint, it's best to be preventative. See your primary care doctor, get screened, which includes screening for colon cancer, screening for prostate cancer, screening for lung cancer if you're at risk, and for women, breast cancer.
In terms of prevention about prostate cancer, is there anything that you can add about that?
Yeah, prostate cancer prevention, bottom line is heart healthy is prostate healthy. So they say Mediterranean diet, which is no red meats, fish, vegetables, and exercise is kind of the one that's been proven to help with prostate cancer. They've looked into different drugs. The studies haven't panned out as well as they've hoped.
Okay. Any particular client that, or patient that you would say will be more at risk or should be more attentive for?
Yeah, for prostate cancer, we do have risk factors. Family history is number one. African American or Black American race is up there. Then we look at the PSA and its relation to the size of the prostate. It's our best screening tool. PSA is a blood test. It's produced by the normal prostate at a certain level, but prostate cancer puts it in the blood a little bit higher. So then we have cutoff levels. We look at the risk, age, race of a person, size of the prostate, and if it's elevated to a certain point that we are concerned, then we head toward a biopsy. Best part of my job is helping people. Be there to explain. The worst part is not being able to help, but at least I'm there to kind of sit, have them understand the situation that we're at. My job is stressful because there's always more people to see. The clinic list gets longer and longer, more and more new patients. You don't want to delay patients' care, but there's only so many hours in a day. Other stressful things is when outcomes aren't as positive as you want them to be. We're always trying to do our best, but bad things always happen. That's the experience of learning how to manage it, to make the bad outcomes as small as possible.
How do you manage to stay well emotionally?
Emotionally, with cancer, I deal with it every day. It's very tough. I think in relieving people's pain, that helps. On a personal level, my family, my kids, a light in the back of my heart.
Would you recommend urology to a medical student or anybody thinking about going into medicine?
To get into urology, it's a surgical subspecialty, which is not one of the core rotations at any medical school that I know of. So you have to be lucky to be put on that rotation or know and asked to go into it. It is a dynamic field, and I think once people see it, they're very interested in it.
Okay. What was your experience? What happened with you? How did you find that you like urology?
I was lucky enough to have a father who's a urologist who pushed me to look into it. It wasn't my first choice of what I wanted to do, but then I found out that it had the combination of surgery, medicine, the patient population, very interesting. You get into it with your patients about, very personal, intimate details, and I was comfortable talking with